You're pregnant.
Oh, there it is.
Oh, wait.
I'm just kidding.
No, I was going to say, you're pregnant. I'm on my period. Is that crooked?
No.
Okay.
You're listening to One Body, where we talk about health, science, and medicine. I'm Cruzy.
I'm Eden.
We're trying to have a good time.
We're not trying to waste your time.
All right, let's get into it. Today we're talking about pregnancy, which is going to be really fun. I'm pregnant for the second time.
Woo!
It's really fun. Very, very thankful. I'm 20 weeks. Weirdly enough, I still feel horrible.
Like what?
We're going to get into it.
Okay.
But like this morning, I woke up so nauseous. And I'm like, seriously? And I ate and I'm not like, I slept so well. I'm not tired. I'm hydrated. So I'm like, why am I still nauseous?
Pregnant.
Pregnant. Yeah. So very happy to be pregnant. Very thankful. And we thought it would be good timing to just talk about pregnancy and survey a lot of our friends who have been pregnant too, and talk about just some of the like funnier, honest experiences that people have. But first, we haven't done an episode just us two in forever.
I know, golly.
So I think the last time was like November, maybe. So what are some highlights, fun things that have happened since then?
It's a new year. 2026.
2026. I'm glad.
Yeah. I feel like a lot of people hated 2025. I have good things to say about it, but I am excited about 2026. I'm 26 years old.
Whoa.
2026.
Golden year. Is that how it works?
No, my golden year was 25
Oh.
because my birthday is April 25th.
Yeah.
But yeah, 26 is kind of legit. 2026 is pretty legit. We had a good Christmas and a new year. We, my husband and I went to Australia to visit my sister-in-law who lives there. And so we were in Sydney for like 6 days and then went to New Zealand, went to the South Island with his other sister, came from LA where she lives, and met us there. And
Even just the way you said that, you're like, we were in Sydney. Yeah. New Zealand. I
Zealand.
can tell which one you liked better.
well, it's not that I liked it better, but I think Australia is much more like Western. It felt like a really fun kind of New York,
Yeah.
LA coastal, I don't know.
Mm-hmm.
I loved it. Lots of like fun drinks by the water and shopping and really good food, good brekkie, coffee, flat whites all day long. Yeah, Sydney was really, really cool. And New Zealand, I think it was just more so like epic, or like I hadn't seen anything like that before.
The pictures you guys sent were blowing me away. It looked like you were in The Lord of the Rings.
Yeah,
which
we
makes
were.
Because wasn't some of it filmed there?
Yeah, a lot of it was. We didn't see Hobbit Town. Hobbiton. That's in the North Island. I mean, everywhere you drive is like a view of some sort. And we drove to, I can't even remember now, 4 different cities or kind of like towns, which was a lot of driving, but the driving is part of it. Like
It's
you
so
get to
beautiful.
see so much.
Yeah.
And yeah, it was so fun. It was a nice time away, like a good 2 weeks of being away, which was fun to do that and then come back to Christmas and New Year's. I have the travel bug now, though.
Oh.
I'm like, all right, we need to go on a trip. Richmond's like, we did go on a 2-week trip to
2 weeks.
Australia. not more than like 2 months ago, but
How was
Stay
the
tuned.
flight?
okay, not bad. It was a long flight. It was 14 hours, maybe 15 hours. And I'm a little nervous flyer sometimes, but I did so good. I was chilling.
You didn't take anything.
Oh, I took something. No, it was like a
It's like a
sleep.
benzo.
I'm like, yeah, I mean, I felt great. No, I only took an Advil PM, like something to help me sleep, which
Has little like
didn't do
Benadryl
anything.
or something in
Yeah,
it.
I don't even know. Richmond's sister recommended that, and she was like, it knocks me out. No, I was very awake, but I love sitting and doing absolutely nothing and watching TV and getting little snacks delivered to my seat.
Yes. I remember I went to Australia after college, and I remember realizing I had eaten like 6 meals and like 6 snacks in 24 hours because
I'm kind of hungry.
well, because I ate my normal day of like 3 meals, a couple snacks, whatever. and then it was a red eye. So
Yeah.
then I got on there, but they act like this is your day.
Yeah.
And so then they give you 3 meals. And I was just like, yeah. And I got there and I was like, I think I've eaten double what I normally would.
But you're just eating like nibbles of weird
It's weird
non-food.
stuff. It's weird.
But I'm like, I paid for this. This is a nice.
I'm gonna eat this weird
I'm gonna eat all of this.
casserole.
Yeah.
What's it called? Calzone.
Yeah, like with a calzone. I don't know what.
Weird. With like nothing in them. It's
Yeah.
just bread.
That's a new thing. They didn't give us little ice cream cups.
Oh,
I love
sad.
those little ice cream cups.
So Australia was good. What'd you learn about yourself? Anything?
Goodness.
Are you in Richmond?
We love to travel together. We do really well when we travel together.
That's great.
Yeah. Like really. I love traveling with him. I feel so safe. So just like
Do you turn your brain off?
Yeah, for sure.
Is he like
Well, okay, I turn my brain off until it's like ding ding on the plane. I'm like, Richmond, it's going down. I know that. That's what that means.
Oh my god.
I just saw the flight attendant sit down weird.
There's a woman on the plane.
Yeah.
There's a
woman on the plane. I don't turn my plane off on when we're, 30,000 feet up. But
once you're there though and you're like walking around, like do you have any idea of directions or time or plans or anything?
Yeah. No.
It's kind of nice.
No, I love it. And Richmond's really good about, like, I don't feel like our family was really this way. Like, we're more cheap, trying to find those budget deals.
Mm-hmm.
He's of the mind of like, no, we're on vacation.
Let's spend it.
So we're going to get 2 appetizers and see which one we like.
That's
and it's so fun to have someone like that because I'm like, really?
Yeah.
Okay.
Vacation Richmond.
Yeah, I love it.
He comes alive.
He does.
Did you see People We Meet on Vacation, the movie?
Yes.
Oh, was that?
No.
It was that bad?
Yeah, sorry. I was like very ill when I watched that. So I'm like, it's very hazy, but I like just watched that.
Yeah.
This weekend.
It's like, what?
No, it's cute. They're like so in love.
Yeah.
Yes.
Yeah. I feel the same way about Ethan. He's just fun and like, we'll spend it and get the extra stuff. It's great.
Yeah.
That's so fun. Well, I'm glad you went.
Thanks. What about you? What have you been up to?
Truly nothing. I've been
Pregnant?
Yeah, I've been pregnant and it's been rough. Like just so exhausted. I haven't done anything that I haven't been required to do.
Yeah.
So like,
well, and you're working and you have a baby.
Yeah, it's like work, take care of Palmer,
Mm-hmm.
maybe get the house to not look like a tornado came through here and there. And then otherwise I'm like on the couch.
Okay.
Yeah. I try to walk at some point in the day.
Okay.
And it takes a lot of effort to get it going.
Yeah. Are you watching TV? You don't watch TV.
No, luckily I've gotten really into reading the ACOTAR series.
Yes.
A Court of Thorns and Roses. So
nice.
I still can't believe that I'm like into fantasy, but I am. I'm just going to own it. Yeah. Cause I'm like, up until probably 2 years ago, I was always like self-help, like spiritual books or like informative books. And then all of a sudden I was reading Verity and Iron Flame and A Court of Thorns and Roses. So anyway, I've been reading a lot. I'm also reading The Housemaid because I got a Kindle for Christmas and it's free on there. So I'm reading
Housemaid, the movie that just came out.
Yeah.
Have you seen the movie?
No, I'm waiting because I have to read this.
Okay.
It's in theater. You saw it?
Yes, I have been counting down the days. I read those books a long time ago.
Oh.
It's a trilogy.
Oh, I didn't know that either.
But the first one's the best one.
I might just read the first one and then watch the movie.
Good.
But I love, what's her name? Sydney Sweeney.
Oh, you do?
I do like her.
I do not.
I
don't think she's a good actress at all.
Oh.
I think she's beautiful.
She's boobiful.
She's boobiful.
I mean, her boobs are insane. Okay, well, I'll finish it and then I'll watch it.
Oh,
but no,
I can't wait.
Just a lot of reading. I try not to do screens with Palmer. So it's honestly, she got really into reading her books at the same time that I got pregnant, which was so nice because she'll like bring me, like I'll just lay on the couch. She'll bring me like 10 books. Oh. And then she'll sit on the couch with me and we'll just read them together.
So cute.
Which is amazing. Okay, let's get into pregnancy. So when I first got pregnant and realized, I don't know, I think I thought initially before I got pregnant that I would be one of those girls who was like, pregnancy's easy and I'm still running and doing a million things and it doesn't really affect me because I'm prideful. And I just am like, I can handle it, whatever. No.
You also are young and healthy and like to be sporty and
Yeah. And I just thought I could carry on. But I'm one of those people, and there's such a range of every pregnancy is so different. The one thing that I want everyone to take away from this is do not compare your pregnancy to anyone else's, and don't compare the way you're handling it to anyone else, because your experiences could be totally different. But yeah, when I got pregnant the first time and this time has been pretty much the exact same. I'm just like out of commission. Like I kind of feel dead to the world. But I'm growing a human being. It's sucking all the life out of me is how it feels. And so it's worth it. But I just like to be honest and because I didn't feel like I really was warned in a sense of it could be really rough. And for some people, they hit, say, the 12, 13 week mark and all their symptoms go away. It's not the case for me. The past 2 times, they just carry on. They gradually get a tiny bit better. But like today I'm 20 weeks and I'm like,
your second trimester is or I've heard it's like you're glowing and you have energy.
The golden days. Yeah.
You're not so big that you're like
uncomfortable.
Yeah.
Exactly. You know, there is a tiny bit of that difference from the first trimester. But anyway, so we asked our friends on Instagram a question, and I thought it'd be fun to just go through their answers because we had a lot of funny ones. So the question was, what's one pregnancy symptom that you didn't expect or weren't prepared for? All right, so the first one is peeing on myself randomly. So it's so true, and I have noticed this way more the second time being pregnant, which means like my pelvic floor is probably a little messed up. But yeah, I'll be standing in the room at work with a patient, and I'll be like, oh, not like crazy, but I'll just be like, oh, not used to that.
So weird.
So that's funny.
When did that start? Like first trimester?
Yes.
Okay. Weird.
There's a hormone called relaxin.
Oh, good.
That relaxes all your tendons and muscles, kind of preparing you for labor, I guess. And so you just
a little too relaxed.
Come out. Yeah. Okay. So peeing on yourself, and then along with that, a lot of people said increased vaginal discharge. So yummy, but
snail trail. Have you heard that?
I hated that.
No, I've been hearing that. It's a thing.
I hate that.
People are like normalizing it.
Snail trail?
But okay, wait, to clarify, I don't know if snail trail means like not on your seat.
No. In
your
undies. Yeah. Like when you go to the bathroom and you're like, there's a little thing there.
Yeah, like
hopefully no boys are listening. They're gonna
I don't know why you would. You don't need. Well, I mean, some good husbands out there.
Anyway,
with discretion.
Lots of discharge, like the whole pregnancy, and then it picks up at the end. So a lot of people do wear panty liners, like
which isn't that not good for you?
I would just buy 100% organic cotton. Which there's a lot of those brands now.
Also, is it truly urine that you're when you pee on yourself, or is it just kind of like fluid?
Urine.
It's urine. Okay.
Yeah. Good. Okay. A lot of people said restless leg syndrome, which is just especially when you're asleep or you're trying to be still, your legs start to feel restless. So like you want to move them around. They don't feel comfortable being still. And so as you could imagine, that makes sleeping really hard. It is associated with iron deficiency and potentially some other like mineral and nutrient deficiencies. So if you have it, you can ask your OB or whoever's taking care of you to check some labs. I did not experience that. And then carpal tunnel syndrome. It just hurts to move your wrist like this. And so, we use our hands and our wrists all day. So it can be really painful. But the weirdest thing is she said she had it really, really bad. She had to buy these gloves to wear at night that kind of compress and stop some of that like nerve pain. But then the second she gave birth, it went away.
Oh,
so
my goodness.
Just weird stuff like that.
And that would just be your feet, not your hands.
It's your
hands. Your hands, not your feet.
Yeah. Yep. Tailbone pain and also pubic symphysis pain. So that's the front of your pelvis where the two sides of your pelvis meet, where that bone is way down there in the front. A lot of people have pain where those meet because, again, the relaxin and the muscles and the tendons are kind of like stretching a bit to prepare. So it's kind of like pulling on that symphysis, and a lot of people have pain there.
Kind of just chronic versus like a shooting pain?
I think it can be both.
Okay.
Yeah. But I've heard just stretching and like exercising too is really helpful. Some people find relief with chiropractic, acupuncture. baths, hot pads, things like that. I did not really experience that. I had some low back pain for sure, but not like specific tailbone or pubic symphysis pain. So, ouch. Okay, this one's funny. And I definitely had this. And like at least 3 or 4 people said they had this lightning crotch. Have you ever heard of that?
Yes, but explain.
It's basically like in your crotch, you get the sensation of lightning
pain.
shooting down.
Okay, that's why I was asking, like, is it chronic versus shooting? Because
Yeah.
I'm like,
I think lightning crotch is different, where you're just like, whoa!
it like if you're talking, you're like, hey.
Yeah, and then it goes away. It's like for a
so
split second.
weird.
Just feels like you got struck by lightning. So weird. I actually had lightning crotch weirdly before I got pregnant. Like I'd be walking and I'd be like having it, and I was like, I think I'm pregnant. I'm having lightning crotch.
But it was not.
And I had my period, and I was like, it's just being a girl.
It's a girly thing.
Yeah. Okay, extreme exhaustion and fatigue, like out of this world, to where you feel like you can't function. Like I remember my first job was shift work when I was pregnant, and the shifts were 12 hours. They were pretty intense. And I just like couldn't make it through the day, or I was a zombie, and I would have to sneak to my car and
sleep,
nap for 20 minutes. I would set an alarm. I brought a pillow in the back of my car, would lay down, zonk out for 20 minutes, and then my alarm would go off, and I'd be like, whoa, and then like try to get back to work. And I was talking to a girl who's still on that team yesterday, and she was like, she's pregnant too, and she's doing the same thing. She was like, yeah, don't tell anyone, but
I think that is a crime. I think there should be mandated rest time for pregnant women.
I know.
Anywhere you are, whatever job you're doing, much less a 12-hour shift.
Yeah, I mean, I agree, because I was like, I'm just not like able to do my job unless I rest
well, and
for
in
a
the
second.
same way that like you legally have to have breaks for nursing or for pumping, I think there needs to be more, I don't know, more support for like during pregnancy.
Yeah, I agree, because I honestly like almost quit, because I was like, I can't really do this. Yeah.
So, and you can't drink coffee or caffeine?
Yeah, we'll get there. You can, but not that much. And like, it's the kind of exhaustion I had never felt it before, and it was very different. Like once I had Palmer, I was tired from sleep deprivation, but it's not the same. This kind of tired is like you're just white.
It's like all of our energy is being sucked to this one thing.
Yes.
Wow.
And so it just feels like you can't, like on the days I wasn't working, or now I'm not working, is like I can't get myself to do anything. And when I didn't have a baby, I would just lay on the couch. Like, and that is not me. Like, I have never been a napper. I've never been a lazy girl. Like,
I've never seen Crazy like watch an episode of anything until she was pregnant. Like, what? Are you okay?
Yeah. And then I'll be like, Ethan, can you get me pretzels?
Oh.
Or like, if I have to pee, I'm so annoyed because I have to get up. That's crazy. That has gotten way better. So I'm thankful for that. This one really threw me off. And then also I've talked to a few friends who work in jobs where they're on their feet and they have the same issue. Lightheadedness and passing out. Ooh. So this is primarily in the first trimester. I have a friend who works in the ICU. She's a PA, and she told me that she passed out trying to do like a line, like an arterial line on a patient, because it comes out of nowhere. And the reason is your blood pressure drops in the first trimester.
Oh my gosh.
So if you already have low blood pressure, and let's say you're a little dehydrated, which is easy to happen in pregnancy, then you can pass out much more easily. And I actually, with Palmer, before I had my first ultrasound, I was about 7 weeks pregnant. I passed out in a patient's room, like fell to the ground.
Forgot about this.
So drama. The patient was like, "Somebody help!" I was like going in to help her, and then I fell on
drama.
the ground.
You actually did pass out.
Yeah. No, I know, but
you're saying for that person, maybe like slightly traumatic.
Yeah, but also drama, because I came to right away. Okay. But then I needed to sit on the ground, and all these nurses came rushing, and I'm like, oh my gosh.
And did they know? They didn't know you were pregnant. Your work didn't know you were pregnant.
No. And I was freaking out because I was like, shoot, do I have like an ectopic pregnancy, which is where implants in the tubes instead of the uterus, or like, is something wrong? So I actually went to the emergency room to make sure. And I think it was like $7,000 later, they did an ultrasound, they did an EKG, ran some labs, did a IV, and everything was fine.
But you had to tell them like, I'm pregnant.
Yeah.
Okay.
Yeah. And they were like, your blood pressure is just low. Like drink some electrolytes.
Oh my
But
gosh.
it's been an ongoing issue. Like up until just recently, I have to chug electrolytes in the morning, and then I have to just eat and drink and sit down a lot.
Oh,
Like I can't
yeah.
carry on like I used to.
Mm-hmm.
So that one's kind of crazy. Increased thirst. Honestly, I kind of experienced that, but this is more nursing is crazy. You feel like,
Unquenchable.
yes, you feel like you can never get enough.
Is it dry mouth or just thirsty?
It's just a sensation of thirst.
Okay.
Yeah, because nursing, it takes so much of the
Sucking it all.
nutrients from you. Okay, a persistent cough that turned out to be reflux. So a lot of people were saying reflux, that was like really bad. And then we've done an episode on reflux and talked about how sometimes they can cause dry cough. Calf cramps in the middle of the night. Oh my gosh, yes. Like,
like
do you
full
love a
body
cramp or do you hate a cramp?
hate.
Okay, I kind of love it.
I'm like, it's gonna cause a heart attack or
I
something.
kind of love it. The thing about a cramp is that the way you're supposed to deal with it, wait, make sure I say this right.
Okay, cramp.
You're supposed to stretch the muscle. So like if you're having a calf cramp, you should pull your toes back to your face and stretch
which is like
it.
the opposite of what you maybe think you should
You
do.
want to like relax
you're like,
it. Yeah. But no, you should stretch it by flexing it.
And that's dehydration, right? Or like, why do you cramp?
Yeah. Dehydration.
In the middle of the night.
Electrolytes could be off. Yeah. Cramping is crazy. Okay. Increased libido.
Okay.
So this is a fun one because like.
But also, you're like pregnant and tired.
It's weird. It's weird. It's like you have this separate area of your energy and brain and capacity that's like set aside for sex. And
it's like they have to keep wanting to be pregnant. So like we have to give them something.
Yeah, I don't know. I don't know what it is about, but it's good because it's one of the few things that might make you feel a little better momentarily. So yeah. And this is not for everyone, but I've heard from a lot of people and I've experienced it myself. My libido's crazy. Like I feel like a 20-year-old boy and it hits out of nowhere at like 3 p.m. in the day and you're like,
that's a great time.
You then come home. And then also some people said actual sensation is much better. Whoa. And it makes sense because you have way more blood flow. You have way more blood flow. So it just feels better. So that's one good thing. The bad thing about increased blood flow is varicose veins. So in the legs, also in the vagina. A lot of people have not heard about this. Also hemorrhoids, which are in the rectum, are just varicose veins. Basically just the vein is swollen from the increased blood flow and then the valves might be a little faulty so the blood just kind of sits in there and then it kind of becomes like everyone's seen a varicose vein on a leg where it just looks like a swollen area on the leg. And it's just uncomfortable. The vagina, I've heard, can feel really heavy and then be uncomfortable with exercise and sex. And then hemorrhoids happen to like every single person I've known that's been pregnant because you get so constipated and there's increased abdominal pressure that when you're trying to go to the bathroom, you put pressure and then you get hemorrhoids. So,
and are hemorrhoids, is there anything to be concerned about with a hemorrhoid?
No, I mean, sometimes they can bleed. And so that's not fun. I mean, usually it's not like a really concerning bleed.
It's popping.
Like a little bit of the skin has gotten like.
And then they just kind of go away on their own, maybe?
Usually, sometimes you have to do like medications or rarely you could have them removed with surgery.
Okay.
Yeah. Which is a really vulnerable surgery.
Well, I've heard something crazy. What? Take this out if we need to. A friend of mine, her mother is an ER nurse.
Yeah.
I'm pretty sure she sprinkled something on them. Like sugar.
Sugar?
And it makes them
shrivels.
Shrivels them up.
Never heard of that.
No, I think that's...
She does that to patients.
A hemorrhoid. That's what you said, right?
Yeah.
Yeah.
Huh.
And she also uses hemorrhoid cream.
Yeah.
Under her eyes.
Oh.
And it's like the only thing that works for her.
Dark
brightness
circles.
And wrinkles and stuff.
Makes sense. Vasoconstricting, probably. Yeah. Interesting.
She's like, it's the strongest, like, nicest cream. But it's sold like cheaper than to get like a really nice cosmetic something.
Feels less lovely, but you know, if it works, that's fine.
You do have to like go and buy the hemorrhoid cream.
Yeah.
But it's worth it.
You'll get over that.
Okay.
I mean, the things you have to buy, diapers and... Okay.
For yourself.
Yeah.
Yeah. Okay.
Yeah. Diapers for yourself. And then nosebleeds, which I'm
good.
sorry for when you get pregnant
Yeah.
because that will get maybe worse. A lot of people have nosebleeds out of nowhere. Just again, increased
I
blood
already
flow.
had that. Love.
Gingivitis is inflamed gums. That can happen. Some people say they get like a metallic taste in their mouth, which can happen with iron deficiency. What else? Gas. Increase gassiness. Don't really know why. I think your GI transit is slower and then gas just builds up. So that one's not fun.
Pressure.
Yeah. Insomnia. So a lot of people have a really hard time sleeping at night. Sometimes it's being uncomfortable. Sometimes it's you have to pee a million times a night. Sometimes it's just your brain is going and you can't sleep.
Restless leg.
Restless leg. A lot of stuff can cause it. Shortness of breath. This one's funny because it happened so early on and it threw me off because I was like, why? This is embarrassing. Like, I don't even have a belly yet and I can't walk up this hill without huffing and puffing. But that's just part of it. And then, yeah, once you get a big belly, it's definitely hard to exert yourself. Round ligament pain is interesting. So there's a ligament down at the bottom of the pelvis that can get really inflamed and sensitive during pregnancy. And people can experience almost like a shooting sharp abdominal pain from it. So that could potentially be what's going on. I have not had that one. Vivid dreams, crazy dreams. I can't even explain them to anyone.
Not always related to like your baby and your family, just like anything.
Crazy.
Oh.
Dreams about people from like elementary school.
Oh.
It's so weird. I'm like, what is going on with my mind? Yeah, so lots of crazy dreams. Some people said they start leaking colostrum, like the pre-milk from their nipples early. Some people around like 20 weeks.
That's crazy.
Yeah, so you might have to wear little pads in the bra. Yeah. Oh, this is so weird. So you might get belly pain when you sneeze or cough because everything's stretched out and it's just hitting the nerves weird.
Okay.
But I remember being kind of nervous. I was like, is something wrong? Because I would sneeze and I'd be like, ow.
Oh.
But then, no.
Yeah.
A lot of
and the
people have
baby's
it.
fine.
The baby's fine.
The baby's like, boink.
The baby's cushy in there.
Okay.
Yeah. And then hair changes. This is the last one a lot of friends talked about. So you get typically increased hair growth during pregnancy. And then you can do, but also like on your face and like your legs. Yeah. But then, a lot of times people will shed post-pregnancy. Again, because you lose so many nutrients and your hormones shift so fast. So.
Okay, wait. One thing that I'm remembering is bile. I've had a friend and a coworker who have had like their bile levels or something.
Oh, yeah.
They get really itchy hands and
cholestasis.
And it's pretty, like, you need to address it.
Yeah.
Right?
It can be more emergent. And that's usually later in the pregnancy.
Yeah.
Like third
like
trimester.
35.
Yeah. Itchy palms and soles, especially at night.
And like hot hands. Yeah.
Is not normal. So, talk to your provider if that happens.
Because I think hearing all of these things, it might just be one more thing that you're like, oh man, pregnancy.
Yeah.
But that one, it is actually, you need to get checked out.
Definitely. Yeah, I mean, if things just feel really off, always go talk to your provider. Like excess bleeding, like some people do have a little spotting after exercise or sex, but if it's a lot of bleeding, definitely that's not normal. Okay, the last one is BO. Okay. And this is funny because it kind of comes randomly. It hits you, for me at least, and I've heard from other people. Sometime beginning of the second trimester, I remember I smelled like, again, a teenage boy, like a rugby player.
It's a different smell.
Yes.
Like, you know, those stress or anxiety sweats, and you're like, oh my gosh, weird.
Nothing can be done.
Oh.
I would have to like take deodorant. I would have deodorant in my pocket. And then
you need like perfume.
I would take a change of clothes. A new shirt to work because it was so bad. But it only lasted like 2 weeks and then it was back to normal.
Did you identify that about yourself or did someone else?
No, I kept being like, who smells?
You're like, it's not me.
And then I literally would do like a sniff and a big,
oh,
it's me. Yeah, that was embarrassing. That was not fun. And then I was like stressed out about it, so I think I was smelling worse. Okay, so those are all the ones from the Instagram question. Thank you, everybody who answered that. My personal experience has been very similar with my first pregnancy and this pregnancy, pretty much the exact same with exhaustion, nausea, reflux, the passing out that I talked about, increased libido, great, Gummy cravings. Love a gummy. I eat gummies all the time.
Little fruit snack gummies.
Fruit snacks, love them. Love the stars from Whole Foods. If you know, you know. And then crazy irritability. Like,
Yeah,
so mad.
I'm afraid about that.
So mad. At nothing.
Nothing.
I'm sitting in the car and I'm like, go faster, get us home. And then I'm like looking at Ethan, I'm like, he's being so sweet and perfect. Why am I pissed off at him?
But it's just a good, like, those are a lot of things.
Yeah.
And I feel like what I see on Instagram or social media a lot is like, your whole life doesn't have to stop when you're pregnant, and like make this commitment to yourself to work out and to like keep going. And I'm like, yeah, but also I don't think that's helpful. Like, if that's what you want to do, fine. But also, given all of those things, it really might be a seasonal, like, I think our bodies are meant to slow down. Like, it's this 9-month period of caring for something else. You are literally growing something, so you have to care for yourself. I don't think our culture really sets us up for that well, but just hearing all those things, I'm like, man, women are amazing.
Yes.
And pregnant women, it's like everyone is getting pregnant and having babies, so it's almost just like, yeah, that's just how it is.
Like, everyone just carries on.
Yeah, but I'm like, that's insane.
It's a big undertaking, and some people find it easy and they don't experience all of these things, but I don't know. I just think it's nice to hear there's a lot of people suffering through it with you if you are pregnant and having a hard time.
Yeah.
And that was another thing that I experienced. Really low motivation to be healthy and take care of myself like I typically would.
Yeah.
And I think that's okay. I think, honestly, some of it's just survival mode for those months when you feel horrible. And that's okay. It's just a season. Like you said, you'll get back. I felt back to myself after some time having Palmer, and you'll get back. But it's okay to be like, man, I don't even want to walk around the neighborhood today.
What about diet? Did you feel like because I know a lot of people are like, everything I put, or I hear, like, everything you're eating, the baby's eating. And it's like, is that even true? Or is that?
No, I do think it matters what you eat. But with Palmer, I couldn't touch a vegetable, didn't want any protein for like the first trimester. And she was fine, and I was fine, and that's so many people's stories. You're taking your prenatal, which has all the nutrients, in case you're not eating them, and so that's helpful. A lot of prenatals don't have iron, so that's the one thing. If you're really not eating iron, you should get your levels checked and see if you need to take a supplement.
Okay. Well, also thinking about your first pregnancy versus your second, like your first, I'm just assuming, so maybe you should just start talking, but like, you're having a baby, so it's exciting, but you also have no idea what's about to come.
Yeah.
Like, do you notice the second pregnancy almost having more capacity to handle these side effects because you know it's coming?
For sure. Yeah.
But you also have a baby to take care of.
It's very different. I think the crazy thing about, I can sit here and be like, oh my gosh, pregnancy is so hard for so many people. And like, these are all the crazy things that happen to you. And like, women go through so much. Yes, true. But the second you have your baby, you forget all of that. It doesn't even matter. It's like, it was like a instant in time that doesn't even matter anymore, because you're just so happy to have this perfect little human, and blown away by the fact that you and the person you love created it. And I don't know, just so thankful. And that was my experience, at least. I was like, I'll do it again tomorrow.
Yeah.
It's all worth it.
Run it back.
And so, that was great to experience. This time, definitely, I have a toddler. I can't just lay on the couch all day unless we're reading a book. So it is different in that way. But I think some people can be like super women, and everything they eat is healthy, and they're exercising every day and able to still crush their work. Some people, it's just not the case. So again, you just can't compare. All right, let's end this with a few common myths around what you can and can't do during pregnancy.
Yes, please.
So, and again, some of these things depends on maybe your OB's opinion. Some OBs are a lot more conservative and careful, and some are a lot more liberal and are like, whatever. So talk to them, but also the general consensus is what we can talk about. So first, sex. Totally fine unless you're told explicitly by your OB or provider that for some reason you cannot. And it's fine all throughout pregnancy. The only reasons that some people would be put on what's called pelvic rest, which is
Mm-hmm.
like nothing going into the vaginal canal and also no orgasm, and
Oh,
because
interesting.
that will cause the uterus to contract.
Oh,
Um,
bed rest?
Not bed
Oh,
rest. It's
sorry.
called pelvic rest.
Mm.
So yeah, that and then no exerting yourself like really intensely.
Hmm.
So the reasons that you might be put on that, and they're not even in literature really supported to be that helpful, but you still might be put on it. If you have cervical insufficiency, so your cervix is where the vagina connects to the uterus. If it's thinning prematurely, maybe, because that's concerning for preterm labor. If you have placenta previa, which is where the placenta, which is the big organ sac that forms to supply the baby with nutrients, if that forms really close to or on top of the cervix, the opening, that shouldn't happen. And that again puts you at risk for preterm labor and bleeding and
Mm-hmm.
stuff. So you have to be careful with that. And then if you have a threatened preterm labor for whatever reason, like if you're having contractions and they're not going away, then you might be put on pelvic rest.
Hmm.
Otherwise, no reason to be concerned about sex. I think a lot of people's husbands are nervous
Mm.
because they're like, I'm going to be
Disrupting.
disrupting the baby or like poking the baby. But
Oh,
first
that's
off,
cute.
it's so cute. I'm like, also like,
Not that big.
you're not that big. And also the cervix
Actually,
is
physically impossible.
yeah, like the cervix is in the way. And then there's your uterus, which is a thick muscle. And then there's
Mhm.
a sac that the baby sits in.
Hmm.
And it has the amniotic fluid in it. And the baby is so cushy and
Hmm.
comfortable.
Hmm.
The only thing about that is around 20, honestly, after 20 weeks, it's usually recommended, but especially after like 26, 28 weeks, you're not supposed to lay on your back for extended amounts of time. So you want to just like avoid that position later on in
Oh
pregnancy.
my gosh. I thought you could just only not sleep on your stomach.
Back.
You can't sleep on your back or
The
your
back,
stomach.
the back is rough, let me tell you. That's also why people have insomnia because they're like, I just want to sleep
That's
on my
why you
back.
have the little pregnancy pillow because
Yeah.
you literally have to be on your
Yeah.
side.
Yeah.
What if you forget and you roll over?
A lot of people do it. I do it. It's fine.
Okay.
Your body will wake you up and you'll move
If it's bad.
yeah. So the reason is when you're on your back and your belly's big enough and the baby's big enough, it puts pressure on the aorta and the inferior vena cava, which are the two big vessels, and blood from those vessels actually goes to supply the uterus and supply the placenta and the baby with oxygen and the things it needs. So if you're compressing it and blocking it, then the oxygen supply might be lowered for that amount of
Okay.
time. A lot of people think you can't do hip bridges and things like that later in pregnancy. From what I've read, that's fine because it's a short period of time. You're still moving. But if you're uncomfortable and you feel like you can't breathe or you feel lightheaded, don't do it.
Okay.
But yeah, you're technically not supposed to sleep on your back or have sex on your back later in pregnancy.
Huh. Okay.
Yeah.
That's good to know.
But if you wake up and you're on your back, just move to your
It's
side.
okay.
It's okay. Your baby's fine.
Okay.
Yeah. Okay, caffeine. We talked about this. So the standard recommendation is that it's okay to have caffeine throughout pregnancy. You want to keep it below 200 milligrams of caffeine a day. So that looks like 2 small cups of coffee a day.
Cappuccino.
A cappuccino is an espresso, which is only 64 milligrams.
Oh, heck yeah, baby.
Yeah, so you can have a few of those.
Great.
Technically. And then a tea is anywhere from 20 to 70 or 80 milligrams. So yeah, you can still have caffeine. I will say there was a new study that came out just this year, a few weeks ago, that reassessed caffeine intake and the safety during pregnancy. And it's actually questioning if any amount of caffeine is technically okay because there's some association with low birth weight and miscarriage and preterm labor, which it's one study. I would just say because I did see that study, I have to mention it. And so talk to your OB about it because up until now, I've been at least a matcha or a tea or like something and no worries. And I did that with Palmer. Everything was totally fine. Most of my friends still have caffeine. But if you want to just be extra careful cutting it out, some people don't even want caffeine when they're pregnant. So it's actually not that hard. Okay, then foods. So you have to avoid unpasteurized dairy, kefir, kombucha, kimchi,
No,
And
no
then like
kombucha.
no kombucha. I know, technically.
Shoot.
I mean, did I have a kombucha a few times? Yes.
Okay.
But like technically there could be some bugs in
Yeah,
there,
it makes
bacteria
sense.
that your body wouldn't like. Mm. What else? Undercooked meat. So you shouldn't eat undercooked beef or chicken.
What do you mean undercooked? Like I can't get a medium rare steak?
No, I would cook it more. I mean, this is all like technically. So many people do. It's
It's for
totally
the
fine.
risk of like a bacteria or
Yeah.
something? Okay.
Listeria is the main one
Listeria.
because it's just way worse if you get the infection pregnant and it can
Okay.
pose harm to the baby.
Sure.
High mercury fish. So, because that's a neurotoxin to the baby. So that's tuna. You can have tuna, but only like a can a week. Swordfish, king mackerel. No one even eats that anyway. So whatever. And then like, raw fish. Like
Sushi.
I will say a lot of people still eat sushi. Totally fine. But there is a risk of there being a bacteria in there. So it's generally recommended not to. Alcohol, completely avoid. There's a risk of low birth weight with drinking alcohol. And a lot of people I know feel comfortable drinking like some wine in the third trimester.
Yeah.
I wasn't because just what I've read, I'm like, why would you risk it? What's the point? I didn't drink at all. And honestly, it's kind of a fun challenge because you get through like
It's
10
good for you.
months. Yeah. And you're like, oh, I didn't drink anything. My liver's so happy. All that stuff. Weightlifting, totally fine. No issues with weightlifting. It's great. It's very helpful for helping with your labor and your recovery after. The only thing is if you've been told specifically not to, if you're on pelvic rest or something. The main thing, and we need to have Zoe on because
Yeah.
Zoe's trained in like, birth fit. So she knows all about lifting weights during pregnancy.
Pelvic floor health and
Pelvic floor health. And then I think the main thing she would say is to make sure your core is braced. So you're engaging your core 365, like pulling the pelvis up, all of that stuff, so that you're not coning. Because if you look at your abs when you're doing an exercise and you're not bracing your core, the belly tones outward towards
because
the
your
front
abs
of your
are
body.
like splitting, right?
Yes, the ligament just stretches.
Okay.
So then what's underneath the pressure can kind of poke through. That's the main thing.
Okay.
Yeah. Did you have any other
What
random
about deli meat? Did you say that?
Deli meat
Everyone
is
talks
the
about deli
same.
meat.
Yeah. I eat deli meat sometimes, but it'd be in the same category as undercooked meat because
Okay.
the risk of bacteria being in there is higher. But like, here's my thing. I've eaten deli meat my whole life. I don't think I've ever gotten food poisoning from it. So I'm like, probably wouldn't happen just because I'm pregnant. But I will only eat it a source that I know is good. If it's questionable, if it's been sitting out, absolutely not. So it's all like what risk you're comfortable with.
No smoking, no Zen, no
Yeah.
vaping.
None of that.
Oh, did you see anything about like sauna or cold plunge? I saw something recently about how cold plunges aren't even good for women's health. They're good for men, but not women.
Yeah.
I don't know if a sauna or anything like that, hot tub,
So,
like
yeah, I don't know actually the studies on that, but I think a lot of people still sauna and it's fine. But I wouldn't, just because I think I'd be in my head the whole time. Like, is this okay? Is this okay? And I would not be relaxed.
What about a hot tub or a hot bath?
A hot bath is fine. I think a hot tub is a bit too hot.
Okay.
Yeah. But a hot bath is fine. A lot of times, like when you're getting close to, like in the third trimester, if you're close to labor, a hot bath feels so nice because it's like relaxing on your back.
And I'm thinking of people during labor, like boiling water, like literally on their back. Like, or no, they're not, sorry. I think I've seen videos where that was really helpful for pain. Just like spraying a shower, like really hot water.
Yes,
So I'm
yes,
like,
yes.
At that point, the baby's coming out. But
No, and I do that to this day. I take a hot shower and I just like
burn your back.
Yeah, just lean over and like let it sit on my low back. I probably take like 30-minute showers now because I'm just doing that. So anyway, that is pregnancy. And I'm not saying all of these things to scare you or make you not look forward to pregnancy, but it's to have camaraderie around pregnancy. You know, if you have a pregnant friend, give them a hug. They're going through a lot potentially. Maybe they're crushing it and they're good. But you never know. And I think it's just helpful to know what potentially could be coming, what a lot of people experience, because sometimes you can feel like, am I a weenie or like a baby that I can't get through this with ease? No, you're growing a human.
You're so strong.
Yeah.
So amazing.
Strong mama.
Anything for any husbands listening, anything that Ethan did that was especially helpful or that, you've gently nudged him to do this time around?
That's a great question. He's been great, especially this time because I have just been like out of commission.
Mm-hmm.
He's really stepped up with taking care of Palmer, especially at night. My symptoms are a lot worse at night. And I just kind of like hit a wall. And so he's been doing a lot of the bedtime routine and like cleanup. And it's been really sweet for them too, to bond.
Mm-hmm.
So I'd say acts of service, just step up and do whatever you can, whatever you have capacity for. And then the other thing is try to still like adore your wife and compliment her, because definitely
beautiful changing body.
the confidence can go out the window. Like trying to find something to wear that you don't feel like a slog on a login is so hard.
Well, also, we didn't really talk about weight.
Yeah.
There's a pretty big range, right?
It's recommended to gain somewhere between 25 and 35 pounds for the duration of pregnancy.
Okay.
So anywhere below that is concerning. That technically the amount of weight that's like just the belly, the fluids, the uterus, the baby is about 17 pounds.
Wow.
But you should gain about 25 healthfully. I mean, some people might be more like 20, but of just like your breasts get enlarged. You do gain a little bit of hips and extra tissue, and then blood volume.
Yeah. So your body will naturally do that, or are there cases where you might need to be more intentional about eating more and fueling your body?
You're supposed to eat about 300 or 400 calories more a day, which isn't, it's not much. I mean, that's like a snack.
Just making sure you're eating throughout the day.
Yeah. Eat protein, eat fat. Like, don't be scared of certain food groups. Carbs are really helpful with nausea. So yeah, there is like, if you gain too much weight, there is an increased risk for hypertension and gestational diabetes and your baby getting big and being hard to birth. So that's why there is a range. Yeah. So just try to be healthy. That's what I would say. I do not weigh myself until my appointments because I don't want to worry about it. But if you go to an appointment and you're like, oh, wow, I actually gained a lot more or didn't gain at all, it's just good to know. I will say some people gain a lot more in the first half of pregnancy and some people don't really gain much weight till the second half. So don't be worried. This is just a moment of honesty. I remember with Palmer, I gain a lot more in the first half of pregnancy typically. And that's kind of like a hit to confidence because you don't really look pregnant yet, but I just look like I've gained weight.
Well, and it's tricky when your clothes aren't fitting like they used to.
Yeah, early, like 8 weeks. I feel like I can't wear any pants anymore. And that is not a good feeling, but I think I was just fearful for more of like the health reasons that I would just be one of those people who ends up gaining like a lot of weight. But I didn't. I feel like it just kind of tapered off and I didn't even change anything. It was just the way my body responded was like a lot more in the first half and then it kind of slowed down. So that could be the case for you too.
One more thing you can't use is retinoids.
Retinoids, that's a good one.
So retinol, tretinoin, any prescription of those?
Yeah.
Why?
Yeah, it's kind of sketchy, isn't it?
Maybe I'll stop doing that.
It's a vitamin A derivative, so technically, like, it honestly wouldn't happen. It's probably totally okay, but don't use it because if some of that were getting absorbed into the bloodstream and then making its way to the baby, vitamin A can, at a toxic level, be harmful to the baby.
Okay.
So, you know the Accutane? That's a pill. That's vitamin A. That's a, like, oral retinoid, basically. That's why, like, you have to be on 2 forms of birth control. You absolutely cannot. It's teratogenic is the word, so it can cause deformities and stuff in the baby.
Do you want to talk about like medication or like prescriptions and or pain management medication? Tylenol, LOL.
Tylenol, so from what I've read, it's still safe. I think like the studies that were done weren't great. And so if you need to use Tylenol, use it. All the controversy that came out about it definitely made me more cautious with it. But, you know, if you have a fever, I would say that's definitely an indication to take it. Pain, wouldn't say Tylenol even works for
Mm-hmm.
me for pain anyway.
Can you take ibuprofen?
You cannot take ibuprofen, so you're
Cool.
kind of out of luck.
Nice.
I would say take a Tylenol if you need to. I just don't even notice the benefit, so I'm like, I'm not gonna
Yeah.
take it if there is some way out there through a theoretical risk.
Mm-hmm.
It's not even really helping.
But
I
a
would,
fever puts you and baby at risk?
Yeah.
Okay.
yeah,
So
potentially. So it's like,
yeah.
I would take it if you have a fever. Other medications, like a lot of the blood pressure medications are okay. You just have to check which one. Thyroid replacement is okay. Levothyroxine is okay to stay on the whole time. Anxiety and depression medicines is up to the provider. Like an SSRI, it's kind of a risk versus benefit. If you are really unstable off of it, it's likely better to stay on. But
For the baby, for you, for both.
for you,
Mm.
personally, I do not take any
Mhm.
medicines, and I wouldn't when I'm pregnant, unless it was like my blood pressure shot through the roof and I
Mhm.
needed something for that. But a lot of people, like there's a lot of medicines that through studies have been shown to be safe or not pose increased risk for harm. Supplements, always take a prenatal. I like ones with iron in it. And then a methylated folate is really important. Any other supplements, I'll just check with your
Mhm.
provider. Like some of them, they just haven't been studied. So it's like, probably just don't take it. I do take magnesium, omega-3, and D3.
Mm-hmm.
Those are all fine. But other ones that are a little more out there, check.
And would you start taking those, like if you are trying to have a baby? What's the more medical term? Family? No.
Trying to conceive, TTC.
If you're TTC, you should start those.
So I say 6 months before, which is kind of crazy. Just go ahead because you want to have a good storage of specifically
Mhm.
folate before, because folate is really important in the very beginning weeks for brain and neural tube development. So I would start taking it 6 months before. I would say that's pretty cautious.
Mhm.
You could probably
It's
start.
also just generally good for you.
Yeah, it's
Yeah.
like a multivitamin. You could start like a month before and
Mhm.
be totally fine. But I would just go ahead and start. And it can be helpful just to get your body like in a really healthy place before even trying.
And you like Ritual? Is the
I
brand?
like Ritual. I took that one with Palmer. I did switch to Weenatal
Mm.
because it's the best in my opinion,
Okay.
but it's like twice as expensive.
Ah.
So Ritual is great, but I think Weenatal, just every ingredient is like the perfect amount and perfectly sourced. And then Parallel, I've heard is a good one. Parallel though, I think you take like 7 pills. And so you think about nausea and reflux, and it's like, absolutely not.
Okay, for those that are like me and pills are not fun to
Yeah.
take, are either of those capsules like gel versus the hard?
Ritual is gel.
Oh, love a gel capsule.
Yeah.
Okay.
Ritual is gel. Some people do have nausea with Ritual.
Oh.
And I've heard if you put it in the fridge or
Mhm.
even the freezer, it helps for some reason. Like maybe
What?
the taste goes away. So you can
Okay.
try that. I take mine at night and then I just go to bed.
Just don't think about it.
Don't think about it. There are gummy versions of multivitamins, but they're usually like the ingredients aren't
Mhm.
quite as good, and they usually don't have iron in them.
Mhm.
But if you're like, it's the only way for me to get something down, that's an option.
Okay. Did Ethan take any kind of multivitamin?
You know, he took a multivitamin. I'm not sure which one, but he did take it. He did take it both times. Now that I think about that.
I've just seen more about that of like his and hers.
Yeah.
Yeah.
So, he really, I just got my sperm from him. Like after that, it doesn't really matter.
Okay.
So, if you're trying as a male to get healthy to then be able to provide something good, it's your sperm. So 3 months before you start trying is when you really want to be like hunkering down on your health. So that's when you should be taking multivitamin, not drinking alcohol, not smoking, exercising, sleeping well, like all of that good stuff. Because you build your sperm in about 3 months. And then once you're pregnant, you're not really getting anything
Kind of
from
off the hook. But then you have to step it up for your girl.
Then you have to step it up. Oh, the other interesting thing about the sperm is there have been some studies showing that the health of the sperm, the health of the male, can actually contribute to pregnancy symptoms and morning sickness. I think it's a very small, who knows how much it's actually impacting it, but that's a good motivator for the guy to be like, I don't want to be dealing with totally miserable life for all these months. So let me try my best to get as healthy as possible and maybe it'll help. I will say Ethan's pretty healthy. I still feel horrible. So I'm like, I don't know how much it actually does, but the studies show there is
But what
something.
was the thing about like the 50% male factor? Is that just for
Infertility?
conception? Infertility, okay.
Yeah, but also a lot of DNA damage that can cause a miscarriage. A lot of that will come from the sperm.
Okay.
So
yeah.
the boys are very, 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 very important
Mm-hmm.
and helpful, and they need to be focused on their health too.
You need a sperm and an egg.
You do. 50-50.
Yeah.
Yeah.
Healthy sperm, healthy egg.
Yeah. Healthy baby. All right. Well, that's pregnancy.
Woo!
Eden, at some point, you're going to go through it. And
I know I'm asking all these questions for myself. I'm
Yeah.
like taking notes.
Yeah.
Proud of you for carrying a little baby.
Thanks.
And proud of all you pregnant mamas out there.
Mamas, have you seen the video
I
of
hate that.
Eloise? Is that her name? Eloise, the like funny girl on Instagram.
Mamas.
She's like, strong mama.
Strong mama.
Go mama. You're so strong mama. Yeah, I hate when people say mama.
But I kind of love it.
Especially in third person. They're like, mama's tired. I hate it.
Mama needs a break.
Mama needs a break. Mama needs a drink. All right. That's all for now. And
Thanks for tuning in.
for listening. Bye.
Bye.